Well, hello and welcome. You're watching India Fights Back with me, Rajat Kain. In this edition of show, we'll focus on youngsters as cases surge across India. Well, as per the latest reports, cases in the month of March has increased more than the cases of January and February taken together, and the experts have flagged that we need to pay an extra attention to youngsters as this age bracket is susceptible to contagion and even as carriers. Well, to have further discussion on this issue, we're joined with Professor N.K. Ganguly, former Director General, ICMR. So many thanks for joining us. And Dr. Sunil Raina, he's Professor and Head of Community Medicine, RPGMC, Tanda. Many thanks, Dr. Raina, for joining us as well. Let me start with you, Professor Ganguly. At the outset, I need your reaction on the second wave, as it's been referred to as. We have seen rise in numbers, especially in the month of March. How, problematic is situation to say of?
The second wave is around the globe. It is because of the mutants. It has not been possible to immunize the population where the herd immunity is reached. So right. Mutants are in the second wave, and there was a plateau. We never touched the bottom. And whenever you are in a plateau, if there is a mutant surge, it comes as a large wave. So it is global. It is not only in India. Secondly, there has been a laxity after a year in following the rules, which will follow even if you are vaccinated. One of my colleagues in Gangaram was vaccinated. Entire family was vaccinated. Every one of them got infection. Not a severe infection, but infection. So you have to follow the rules. The children thing is also global. There are two very major articles which have come up. One in the BMJ and one is the JAMA, which analyzes does meta-analysis of European surge in children as well as the American surge in children, which has been seen in California, Texas, and Michigan. And these children are below 10 years of age, and the infection is quite severe. There is a particular mutant which has appeared in California which is causing this. And we are seeing the same surge in India in the children. We knew there was severe form of infection in children, which was known as a systemic vasculitis as well as septic shock-like syndrome. Small number of children used to get it. Now, some of the children, the percentage is same as it is in the adult. So this is a transition which has occurred. And here we need to take some new precautions. Right. Luckily, there is very good news today that Pfizer's 12 years to 15 years data has shown 100% protection. This is very good news. You could now safely immunize, and the other Moderna vaccine as well as AstraZeneca, etc., completing this. And so if we could put in the arm of 12 years and more a vaccine, this will protect these children from the severe infection. And then the main thing which is particularly happening, if you see the states where this is happening, all these states, uncontrolled surges happening, Maharashtra, Kerala, Karnataka, etc. So here we will have to look at different policy. We will have to put the vaccine in the arm of all the eligible. In rest of the India, whatever we are doing. But in these places, we have to put the vaccine in the arm of all the eligible. My final statement before the next round comes that one country in the world which has shown that it could immunize 90% of its population. In Europe, that is Serbia. They have given a damn from where they get the vaccine, whether it is European Union sanctioned or not. They said that we have to protect our population. So now from the rest of the Europe, people are going there to get vaccinated. So they have been a very good success model. Apart from Israel, Serbia is a very good. So we need to see and study, and we need to do that.
Right. Many thanks, Professor Ganguly. I'll come back to you. Dr. Raina, your reaction as well, how important do you think is it to pay attention to youngsters? I'm not saying just children, but the youngsters age group, which stretches from 15 to 30, and especially in the wake of rising cases?
It's absolutely must that we need to take care of how exactly the situation has panned out as far as India is concerned. Now we need to look at a few things before we go to the kids or the youngsters in general. What has happened is, as Professor Ganguly rightly pointed it out, that we didn't touch zero. So we didn't have a zero COVID situation at any point in time. What we did was, for last 1 year or so, we had situations which were frozen at that point in time. By frozen situations, what I mean is schools were closed, colleges were closed, people used to work from home. Now, over a period of time, once the cases started coming down, these situations were unfrozen. So you had schools, kids going to the school, you had people going to their jobs. Now, this added to the already existing large population of susceptibles. So you had a large susceptible population now, which was not earlier available when we had the situations frozen. So what did this do? It bred in a sort of a response paradox, which I call it. So if you had, say for example, in a city like Mumbai, if you had 100 people, 50 of them would respond to the government guidelines in pure submission mode. They will respond to each of the guidelines. 50 would not respond to them. Once the cases started coming down, what happened was that these 50 who were earlier responding to the guidelines very well have again stopped responding to the guidelines. So complacency started creeping in there as well. So lesser number of people responding to guidelines, more number of susceptibles were put into the system. An important thing to remember is that this newer number of susceptibles who are put into the system, the youngsters, are always risk-taking people. They are not the ones who are going to respond to the guidelines as easily as those who are adults or elderly people. This is a risk-taking population which will go out and move without responding to the guidelines. So this is very important that we need to put it across to these youngsters that guidelines, follow-up of guidelines is very important and mandatory if you are to take care of this pandemic.
Right. That's important. Professor Ganguly, you were talking about two main reasons for increased number of cases and of course like effect on the youngsters. First happens to be the new strain, and second, of course, like somewhere down the line there is a complacency. Now, let me ask you one question here. Like even when we have seen that people are following COVID appropriate behavior, there are surge in the cases. I know like there has been a sense of complacency as well, but vis-a-vis new variant, is there a study that shows its response towards COVID appropriate behavior like social distancing or mask? Is the new variant much more penetrative even after you are taking all these care?
Actually, mask protects much better than vaccine. Double masking protects up to 85%. There is a study. However, this virus is a totally new beast. Nobody has encountered this virus before because this virus is spread by asymptomatic people. None of the other viruses were spread in this rapidly by asymptomatic people. And this is spread by an age group which you exactly said. They are 18 to 29 to 30 years age old. These guys are largest spreader. They are not in the vaccination list. And as Dr. Raina said, these are the guys which do not like to follow rules. They like to party. And this is happening all the while. If you go to a marriage party now, you can see 200, there are 400 guys. Some inside the room, some outside in the lawn. So this asymptomatic spreadability of this virus is a very dangerous thing. We never saw this thing before. So now when we are opening up schools and colleges, we need to immunize our teachers. And we need to do a heavy investment in the schools. Investment is like this, like suddenly our classes increased. All India should had 50 students, now there are 130 students. There are classes with 250 students. You cannot have such classes. You need to have size of classes which will be not more than 30 at all, so that you can keep distance and you could really follow the rules which spread the virus lesser. and you will have to provide the sanitization and the PPEs to all the staff, and at least immunize at this given moment, which is up to the rule, all teachers, every teacher and every caregiver in the schools. And when we have the data, now we have 12 to 15-year data. When we have data, more data, immunize the children also,
Right.
so that they can go to. This is one of the very major drawback of children not being able to go to school. We can work from home, although as a doctor we cannot many times, but many people can work from home. Children sitting at home is killing for the parents and adults, those who they cannot go out for work, as well as it psychologically affects them. So we have no choice. We have to open up schools, but we need to do a heavy investment in schools so that we cut sizes of the classes, we do sanitization, we provide adequate PPEs, and we vaccinate the teachers as of now. And we need to understand that these children will also be spreader. They will be infecting their granddads, they will infecting their dads, and so some or other, this investment will be the most difficult and expensive investment which our government need to do.
That's really important. The schools and of course these institutions, they need to invest, and that to invest, quite seriously on providing care about PPE and of course encouraging COVID appropriate behavior. Mr. Raina, Dr. Raina, let me ask one question here. We usually we are saying that youngsters need to do this and they have to follow COVID appropriate behavior. There happens to be some sort of a laxity, but at the same time, we have to also realize, these youngsters are among very important workforce. Many of them are frontline workers, many of them are into medical services, many of them are going to the offices to make their ends meet. Now, how difficult is it for youngsters even to actually balance it out, to carry on the work, to earn and to do important work like being a frontline worker in medicine, in civic profession, and at the same time making sure that they are away from the contagion?
This is very important, and that's probably wherein planning comes in. Now, how do I see it? I see it that if you look at from the country perspective and start designing a plan for youngsters from the perspective of the country as a whole, that a national plan is in place for the youngsters, I don't think it is going to work. What we need to have some sort of a sub-national plan. And if you look at the current surge, of infection, you can very well contain that surge to certain geographical limitations. Okay. So it's not a well spread out across the country like the first wave was. It is still limited to certain areas of the country. If you come down to the lower levels, if you come down to the state levels, come down to the district levels, again in those districts and state levels, it may not be widely spread up across the district. As I see in my place, my entire district is not heavily reporting cases. It's some pockets of my district which are reporting cases. So what we need to do is build a micro plan wherein these youngsters are a part of that micro plan, and that micro plan should be bottom up. So what does that mean? As Professor Ganguly rightly pointed out, schools have to open, offices have to open, but we need to geographically contain those areas which are coming up as hotspots and open up other areas which are relatively free. Maybe something like a green zone strategy. Okay. So every district should have a green zone wherein all activities can be permitted, and every district which has a red zone, lesser number of activities can be permitted. Within those lesser activities, we should be making everybody aware of the outcome of the pandemic. That is the key. The messaging has to be there. If you look at the first part of the pandemic last year, messaging was very prompt, very important, but messaging has fallen down. We are not very serious with the messaging part which was there in the first part. So everybody who falls in the hot zone has to receive correct messages that how exactly they need to behave. Offices need to be taken into consideration. That is something that we keep telling it. Private sector, if somebody works in the private sector employees should have their own plans in place. The offices should have their own plans in place. How to stagger the crowd. How exactly to see that only 5 people come in the morning, 5 in the day, 5 in the afternoon, something like that. Staggering the crowd will be very important. Staggering in schools will be very important. Staggered timing will be the key as far as these offices and schools are concerned.
That's important. Now, Dr. Raina, before I move to Professor Ganguly here, basic question here. Were we caught off guard? Like, did we not see this second wave coming to us when there were several countries in Europe which had reported second wave? There were, even in US for that matter, there were surge in cases after hiatus. So, were we caught off guard?
I would not say we were caught off guard. I would say most of us live, it sounds certain philosophical, most of us live in a compromise mode. So what we did was, we were at one point in time seeing that there was a fall in the number of cases. The overall number of cases were falling. So maybe in the month of February, we touched around 9 to 11,000. So we were seeing that the number of cases were declining. At the same point in time, we wanted that anybody who in this country should not suffer from economic fallouts. So we had to make a compromise. We had to strike some compromise in it. So what we did was, before hitting zero, which should have been the key, which should be the key in all situations, before hitting zero, don't open. We couldn't go for that. Our compromise made us to go for opening up of the country as a whole before hitting zero. But I don't say this is something that we were caught off guard. This was something of a necessity for us. We could not have sustained our economic livelihood after continuing for such a long time of economic depression for such a long time, and still would have survived this economic lockdown. I don't think economic depression. I don't think we would have been able to survive it. So that compromise, something didn't work in our favor. We were anticipating that this fall will keep going down, but it didn't go. It came up, and that is something that has happened. Not off guard, but I think we compromised at some point in time.
Right. Professor Ganguly, you also agree that we're possibly living in a compromised space in terms of, just a thought about like its numbers are going down, so let's take it easy. Is it so?
Actually, I agree with Dr. Raina. We really didn't compromise. The best public health or environment in the world, they couldn't handle it. Everywhere it has happened. We in our country it didn't happen that much, I must say. But you just look at the USA, even if they have done 100 million vaccinations, the Europe, you see that it's happening there with very good public health systems as well as the infrastructure. So we were not caught. This is a very, very unique beast, and we didn't touch. We had a plateau. So we had to work responsibly. For this, there were 4 things which were very, very necessary. We should have the world-class surveillance, both for environment as well as the population, so that we could do modeling like Chris Murray's Institute and others, and say that these are the places where we will get a surge. Please be very careful in these places. We also should have created systems or prevented systems where we could, like, if you look at the Bombay train, I think that is one of the major triggers for Maharashtra. It is packed. People are packed like sardine, and these trains opened up. You see the farmers' agitation, so Punjab is likely to get it. And if there is an infection, one more thing we should realize, that if there is an infection anywhere in the world, we are vulnerable. Like those who are getting tested before they boarded the plane, only 9 or 10% was predictable that they are perhaps negative. Many of them tested positive when they landed. It all depended at what time they were tested. So they are coming from all over the world, and even if they are quarantining, we do not have in India that kind of quarantining system where you wear a band and one could monitor that you are really home quarantining or not. And we cannot make expensive quarantine in the hotels. This is not possible in our situation. So we need to ramp up our diagnostics, contact tracing, as well as we need to ramp up our surveillance and make it so smart that we are able to predict and forecast. much before the outbreak occurs. Finally, there is no alternative to mask, which your last sentence is that even if you are vaccinated, even if the entire family is vaccinated, even if you are in a bubble, please wear the mask, please keep the distance. You will be protecting others and you will be also, because vaccination is not a guarantee that you will not be infected. Only thing it protects you is from severe infection and in the hospitalization, so that you do not die with that.
Right.
But you are vulnerable and you could infect others. So vaccine doesn't give you a passport, which many people are using, many countries are using. It gives you a passport that you can do whatever you like. It doesn't happen like that.
Right. Dr. Raina, in this week, there has been two important statements. Let me just read out to it. One by the center, the situation is going from bad to worse. And second from Dr. V.K. Paul, he is chairman of National Experts Committee on the Vaccine Administration. Dr. Paul says, well, the trend shows virus is still very active. Just when we think we can control it, it sparks back. When juxtaposing these two statements and, looking at the technicality of virus, is there any particular variant of concern that we are looking at with an interest so as to have control on the surge in number of cases?
Look, every time a pandemic will come, a pandemic like this, variants are bound to happen. This is something that is the natural phenomenon of infectious disease epidemiology. How many variants will come, that is again depends upon time itself. So how many variants will be there? How many of them will become popular? That is again depending upon time will only tell us how many of them become popular in the system.
Right.
One thing we need to realize, if we look at the latest data that has come up from Delhi or Mumbai, what we have seen is that the newer surge of cases has reported moderate intensity disease. The patients who report to the hospitals are not severe. So the patients who generally come to the hospital, lesser number of patients are reporting to the hospitals. And those who report to the hospitals with any pathology, they are not of severe category. So what does that mean? That means that the newer variants, some of the newer variants, which are catching up with these youngsters, are not, they are producing a disease which is moderate in intensity.
Okay.
So if you have a variant which is producing moderate intensity disease, we need to be aware of such variants. Because these variants are the ones which will increase the number of cases and will go unnoticed as well. No patients, no major symptoms will be there. So patients will go unnoticed. But the bulk of the patients, total number of patients will continue to surge on. And once the number keeps surging on, the mortalities will ensue afterwards. So at this point in time, if we see 70,000 cases of 70,000 cases with moderate intensity or low intensity disease, but once this number starts going up, this number will build up because of the fact that the disease is moderate. It will be transmitted more easily. So the numbers will go up, then the mortality will ensue because the numbers itself will overwhelm the health system. So what we need to look at this point in time is that the disease being moderate does not mean good to us. It means that we are in for trouble. That is one. And that's why you are seeing higher number of cases over a period of time. Within a span of time, the number of cases has increased. So that's why Dr. Paul has rightly pointed it out. We need to be very careful. Asymptomatics will continue to transmit. Moderate intensity disease will continue to be transmitted. The key will, as Dr. Ganguly pointed it out, we need to stay with the same. The MSPs, the mask has to be there in place. The sanitation of hands has to be there. And physical distancing, these are the key, and this will have to be the new normal for a long period of time. Vaccination, not now, not for a long period of time, is going to save us from this pandemic. It has to be these three only. And we need to build on the systems that made us successful. India was able to reduce the numbers on certain parameters because of the fact that it did certain things very well. As I said, education was key. It was able to educate more number of people. So that is something that needs to continue. Everybody needs to be made aware of these things. That the virus is there. It's not going to go up tomorrow. You need to be careful. And those who are vulnerable more, they need to be taken care of. So elderly are vulnerable, but the youngsters will bring in the infection. So take care of youngsters, give them information, and don't let them take the infection to the elders. So that's something which we need to do if we want to mitigate the impact of this pandemic.
Right. Many thanks, Dr. Sunil, Raina. This is extremely important. Many thanks, Professor N.K. Ganguly. Just explaining us what we all need to do amid the surge in the COVID numbers or the second wave, as we say. At the same time, we need to take care of youngsters as much as we're taking care of the elders and the toddlers. Well, on this note, we sign off here. But before we leave, there's a small appeal from all of us, and that is what the experts are also reiterating time and again. Please keep following COVID-appropriate behavior, keep washing your hands, keep wearing a face mask, and do not forget to follow physical distancing. Remember, these are small little things that can help us in defeating the pandemic. Well, that's it in this edition of India Fights Back. Thank you and goodbye.